Let me present Udenafil for the treatment of erectile dysfunction and give an overview of this article. Erectile dysfunction is often perceived by both patients and sexual partners as a serious problem that can jeopardize quality of life, psychosocial or emotional well-being, and the partnership in the long term. Although many treatment modalities have been introduced to address it, the advent of PDE5 inhibitors have revolutionized the medical treatment for ED, which offer advantages over other treatment modalities in terms of ease of administration and costs. To date, there are 4 PDE5 inhibitors: sildenafil, vardenafil, tadalafil, and avarnafil, approved for the treatment of erectile dysfunction worldwide, and Udenafil has been approved in 13 countries, including Korea. In this review, we highlight the evidences for the efficacy and safety of Udenafil in the treatment of ED. Udenafil, one of selective PDE5 inhibitors, was developed in Korea and improved for the treatment of ED in 2005. Its pharmacokinetic profiles include a Tmax of 0.8 to 1.3 hours and a T-half of 9.9 to 12.1 hours, which could confer clinical properties of both relative rapid onset and long duration of action. Compared with placebo, Udenafil significantly improved the erectile function domain scores of IIEF, the rates of successful penetration and maintenance of erection in men with ED of a broad spectrum of etiologies or severity. Also, Udenafil treatment showed greater increases in positive responses to the global assessment question compared to placebo. Also, Udenafil is safe, effective, and well tolerated for the treatment of ED in men with underlying hypertension who take anti-hypertensive drugs. There is positive evidence that Udenafil can be as effective in the treatment of diabetes mellitus-associated ED as other PDE5 inhibitors. Due to the clinical properties, Udenafil can be another option of daily dosing for the treatment of ED, as suggested by favorable efficacy and safety profile. Co-administration of 100 mg Udenafil and alpha-1 blockers improved erectile function and lower urinary tract symptoms in patients with both BPH and ED. Also, the concomitant use of alpha-1 blockers does not significantly affect the safety profile of Udenafil. Most adverse effects reported by clinical trials are mild or moderate in severity, without any serious adverse event, with headache and flushing being the most common. To date, there have been no data on long-term efficacy and tolerability of Udenafil for the treatment of ED. Also, there has been sparse data on efficacy and safety of Udenafil for the treatment of ED in other ethnic populations than East Asian population. Thus, research on ED treatment using Udenafil is still ongoing. In conclusion, Udenafil has proven to have high efficacy and a favorable safety profile for the broad spectrum of ED patients, which are comparable to those of other PDE5 inhibitors. Due to the clinical properties of relatively rapid onset and long duration of action, Udenafil may be a better option for ED treatment according to patient-specific sexual life patterns. Udenafil is as effective in the treatment of diabetes mellitus-associated ED as other PDE5 inhibitors. Further studies are still required to validate the efficacy and safety of Udenafil and to complement the scientific basis for rational, evidence-based prescription and dosing decision. Thank you for your attention.